called PCOS. It's a very common disorder and it affects like 10%. Hello everyone, you're welcome to another episode of How to Get Pregnant and Have a Baby. My name is Dr. Babatunde Okewale. I'm the MD CEO of St. Ives Healthcare Organization. I am an obstetrician and gynecologist. I'm also a fertility expert. We'll be talking today on Polycystic Ovarian Syndrome, otherwise called PCOS. It's a very common disorder and it affects like 10% of all women in their reproductive age group. Now, what happens in polycystic ovary? The main thing that happens is it causes anovulation, that is, absent ovulation. Sometimes it causes oligovulation, which also means infrequent ovulation. The main thing that happens in polycystic ovary is that the ovary of the woman produces excessive androgens. Androgens are male hormones. They are normally supposed to be produced in very small amounts in the ovary of the woman. But in polycystic ovary, the level is raised or higher than normal. And all the distressing things that happen with polycystic ovary usually results from that excessive androgen. In polycystic ovary, you would find, if you do an ultrasound scan for the woman, that she has an enlarged ovary with multiple small cystic or follicular cysts on her ovary. And when you do the blood hormone test, you will find that there is excessive androgen in her system. The end result of polycystic ovary is it does not allow the woman to ovulate. It disrupts her menstrual cycle. Either she becomes amenorrheic, that is, her period becomes absent, or her period becomes oligomenorrheic, it comes infrequently. And secondly, it blocks ovulation. So a sizable number of women with polycystic ovary presents with infertility. What are the symptoms of polycystic ovary? What are the things you look out for to make you think that maybe you have polycystic ovarian syndrome? The first thing is infertility. Like I said, it's one of the commonest causes of infertility. Whenever you see a woman in her reproductive age group complaining of inability to conceive and also having menstrual disorder or not ovulating, then you start suspecting polycystic ovary. The second symptom is irregular periods. Irregular periods could come in forms of not seeing her period, or her period comes infrequently. Another thing is recurrent miscarriage. If you find a woman who is having recurrent miscarriage and you don't seem to know what's happening, one of the things you check out for is whether she's suffering from polycystic ovarian syndrome. Now, when we talk about recurrent miscarriage, we are talking about miscarriages that have occurred consecutively on 3 occasions or more. Consecutively, that's the key word. That is one after the other. Other symptoms of polycystic ovary include the symptoms that are directly as a result of the androgens. That's the male hormone. So you find in such women, they have what we call oily skin. Some have pimples or what we call acne. Some have abnormal hair growth in their body, especially on their upper lip, in their chin, around their nipple, or in their abdomen. All the places you expect a man to have hair growth, you find women having hair growth in such places. Another symptom of polycystic ovary is obesity. The body mass index of such women is usually above 30, so they are obese. One other thing that is noticed with polycystic ovary is such women are usually insulin resistant. Not that they are diabetic, but when you check, you find out that they suffer from insulin resistance. And so, how do you diagnose it? The best way to diagnose polycystic ovary whenever you are presented with a woman is to take a very detailed history. From the history, all those things I've mentioned, the woman might complain about them. Not seeing her period regularly, not ovulating regularly, trying to conceive, and you must go all out to ask about those distressing symptoms caused by androgen, because most women will not tell you. Ask about the abnormal hair growth, the acne, the pimples, and the oily skin that they do have. So how do you make the diagnosis? Apart from the symptoms that the woman has given you, you want to do some blood investigations as well. Now, the blood investigations include measuring the level of the androgen in the woman's blood. Androgen and testosterone, usually they are well high up. And when you do also the hormonal analysis of the woman, the LH, which is the luteinizing hormone, over the FSH ratio, FSH means follicular stimulating hormone. When you put the two ratios together, ideally they should be 1. But when you find them being excessively above 2, it is very suggestive of polycystic ovarian syndrome. So let me give you an example. If the FSH is 5 and you find out that the LH is 15, that's a ratio of 3. That is very suggestive of polycystic ovarian syndrome. The clincher, however, is when you do an ultrasound scan on the woman, you will find that the ovaries contain a lot of follicles. And the follicles are arranged on the ovary in such a way that they look like a string. We call it the pearl string appearance. Is very diagnostic of polycystic ovarian syndrome. So if a woman complains of all those symptoms and you do hormonal test and the LH over FSH ratio is above 2 and the androgen levels are high, and you do an ultrasound scan that shows the typical polycystic features, then you can reach that diagnosis that the woman suffers from polycystic ovary. What's the treatment? The treatment will depend on what the woman wants. There are quite a lot of women who have polycystic ovary, and all they are concerned about is they are not seeing their period and they are having all those funny symptoms or signs of excessive androgen, but they do not want to get pregnant. So the question you need to ask every time is, are you trying for pregnancy or you are not interested in pregnancy? If a woman has polycystic ovarian syndrome and she's not interested in pregnancy, then all you need to do is place her on the birth control pill to try and rearrange the hormones in such a way that she will be seeing her period regularly, and some of those distressing symptoms of acne, oily skin, abnormal hair growth will disappear. But if she's trying to get pregnant, then you need to make sure she ovulates. The mainstay of treatment for polycystic ovarian syndrome are twofold. There's the lifestyle change approach and there's also the drug approach. The lifestyle change approach is talked about because in a sizable number of women who have polycystic ovary, they are obese. That is, their body mass index is far above 30. So they should try and lose weight. Losing weight by diet and also by exercise. It's been found that losing just 10% of a woman's weight, a woman who has polycystic ovary, is enough to restore their period and also to restore their ovulation. The second thing you need to do is place them on ovulation drugs so that they can be ovulating regularly, so that they can achieve pregnancy. There is a particular type of drug called metformin. It's a drug that normally we use for people who are diabetic. And it's a drug that is especially useful in insulin resistance. Don't forget I said that in polycystic ovary, there's usually a level of insulin resistance. So that drug, metformin, has been found to be extremely useful in polycystic ovary. If you place a woman on it, it rearranges everything such that they start ovulating, their period starts coming, and they could achieve a pregnancy easily. Of all these things I've mentioned, what matters most is persistence. For most women, they will have to use either the ovulation drug or the metformin, especially women who are trying to get pregnant. They will have to use it consistently for between 3 to 6 months before they see the effect. For majority of the women, they will get pregnant within that time frame and their period will be restored. In a small percentage of women with polycystic ovary, ovulation does not come with using only the drugs. Sometimes we might have to give injections. Injections we call gonadotrophins. They again increase the ovulation and makes them to ovulate. Rarely, when all else fails, we might resort to IVF in polycystic ovary. Why does polycystic ovary cause infertility? That question is usually asked. The basic reason is it does not allow a woman to ovulate. And not only that, even in women who ovulate and have polycystic ovary and do get pregnant, there is a higher incidence of miscarriage among them. In fact, they have like double the rate of miscarriage than in the normal population. Thank you for watching this short video on polycystic ovarian syndrome. I would like you to continue subscribing to this YouTube page. You can like, comment, and share the page. You can also get more information from my book called How to Get Pregnant and Have a Baby. It's available on Amazon. It's also available on our website, www.stivehealthcare.com. Thank you.